Majesty. Today we are going to discuss our proposed solution to hyperacidity. Our proposal is entitled Alkaline, Fiber, and Unsaturated Fat, a dietary regimen to prevent hyperacidity and acid reflux. Hyperacidity and acid reflux are common problems in the stomach caused by excessive gastric acid that tends to push its way up to the esophagus, thus causing heartburn. When left untreated, it could lead to more complicated health issues.
Excessive acid in the stomach is often linked to poor and unhealthy habits, resulting in an imbalance of pH acidity level in the stomach and the esophagus upon reflux. In the Philippines, the prevalence of hyperacidity has increased from 3 to 9% to 14 to 16%, and in terms of age, said disease is most common in ages 20 to 29. To address this problem, the researchers aim to provide a dietary plan for people experiencing hyperacidity and acid reflux to ensure this gastric problem from worsening.
There is actually a diet plan known for reducing hyperacidity and acid reflux. It's called the ketogenic diet. According to the study of Dashti, dietary patterns of ketogenic diet has been proven to effectively reduce the contingency of acid reflux or hyperacidity. However, some dietitians have claimed that the diet can cause nutrient deficiency and involve saturated fats that might trigger hyperacidity. There are macronutrients in and out of the ketogenic diet that are scientifically proven and tested to be beneficial and effective in preventing gastrointestinal issues, namely alkaline, dietary fiber, and unsaturated fats.
Alkalis are very healthy, beneficial, and effective in reducing hyperacidity and acid reflux. Alkaline food and drinks contain pH levels that are greater than 7 and are low sources of acids, fats, and calories, which can help improve human health and increase metabolism. Most importantly, their alkalinity neutralizes the corroding acids in the stomach. Fibrous foods also help regulate acid levels in the stomach. Soluble fibers absorb liquid from digested food, leaving someone more satisfied. When one is full, the gastric glands are not triggered to produce excess gastric or stomach acid. On the other hand, insoluble fibers speed up the stomach contents into the intestines, thereby decreasing the opportunity for the acid to reflux. Chances of hyperacidity and acid reflux to occur is also lower if we consume unsaturated fats. Unsaturated fats are easily digested compared to its counterpart, the saturated ones. According to Feldman 2021, replacing saturated fats with unsaturated fats in food consumption greatly lowers the risk of gastric inflammations. With these findings, this makes unsaturated fats a good nutrient in providing more health benefits to the body. O'Doherty 2011 further strengthened this analysis with the conclusion that acid reflux is less triggered by unsaturated fats among patients with esophageal reflux.
With this being said, the researchers aim to test the hypothesis if alkaline, fiber, and unsaturated fat-based dietary regimen is implemented to people experiencing acid reflux and hyperacidity. Then, there will be a lesser chance for this gastrointestinal problem to recur and aggravate. Furthermore, the researchers also seek to answer the following questions. In constructing the diet plan, the researchers center majorly on alkaline, unsaturated fats, and fiber while still reaching the daily nutritional intake the human body needs on a daily basis. In order to ensure an effective program, a budget meal planning along with a menu will be provided as a guide for the participants.
The researchers chose to break down macronutrients as the basis for the content, as this helps the body gain, lose, or maintain weight. In this dietary program, the focus of the macronutrient breakdown will be the maintenance of the body's weight. To ensure that the amount of nutrients consumed are correct, an ideal ratio of 25 to 30 to 45% of fat, protein, and carbohydrates respectively will be used as the basis in this diet. In order to calculate the daily needed macronutrients of the human body, the standard basal metabolic rate or BMR of Filipino man and woman are needed, as well as height, weight, and age. As mentioned earlier, people of ages 20 to 29 experience hyperacidity the most, so this diet plan will use the age 25 as basis in obtaining BMR. The Mifflin-St. Jeor formula will be used to calculate the BMR. With a few calculations and the use of the standard weights of Filipino man and woman, the BMR on a daily basis of males is 1,509 calories and 1,198 calories for women. Now that the BMR is calculated, the macros needed for both man and woman can now be calculated also. From the macronutrient breakdowns shown, these are the daily meal plans for both males and females.
This dietary program has restrictions to ensure effectiveness. As mentioned earlier, the diet plan is constructed by breaking down macros into calories. This is because calculating calories does not take into account the nutritional needs that a person needs per day. Moreover, this dietary regime may not be totally applicable to dieters with varying BMR since every person has their own individual calorie intake. Participants may also feel restricted in terms of the availability of the foods enlisted in this program. In conclusion, hyperacidity has become a common disease. To address this proposal provides a dietary program composed of alkaline, fiber, and unsaturated fats in order to effectively reduce the contingency of hyperacidity and acid reflux while still getting the required daily macronutrients. This program also manifests the importance of people to know their food consumption and bring awareness of their lifestyle. With a wide range of options to choose from, participants will not feel too restricted, allowing them to enjoy their nourishment while still being healthy. This proposal will not only help prevent hyperacidity, but also improves the well-being and physical fitness of the person.